that means that I'm just going to be handing the mic over to Priyanka. So Priyanka, whenever you want to get started, it's all you.
Thank you, Ren. So hi, everyone. How are we all doing today? Awesome. So many of you already know me. My name is Priyanka, and I'm a senior at the DA. And today I'm here with Alex Potter, who is an undergraduate student at UC Berkeley and the program director of the American Lung Cancer Screening Initiative, or ALCSI as we like to call it. And so today we'll be presenting on lung cancer and lung cancer screening, which I think goes in line with some of the topics you guys have been talking about in midlife. So before we get started, I'd like to request that everyone is muted during the presentation. However, we would love to take questions at the end of the presentation. So please feel free to put your questions in the chat box for Alex or I to address. And if you're interested in learning more about ALCSI, we'd like to invite you to visit our website at www.alcsi.org and to please email us with any questions if you have any. So before I get into the content of the presentation, I'd like to share a little bit about what the American Lung Cancer Screening Initiative does. So ALCSI is a 501c3 nonprofit that works to raise awareness for lung cancer and lung cancer screening. And we are a team of 50 passionate students and doctors located across the US. And we've worked with community organizations like the South Asian Network and American Indian Cancer Foundation, as well as city and state departments, including the NYC and Connecticut Health Departments. And so we hope that in educating communities about lung cancer and lung cancer screening, high-risk community members will be encouraged to seek lung cancer screening. So today we will be discussing both lung cancer and lung cancer screening, addressing questions such as how common lung cancer is, what is lung cancer screening, and how you can get screened. So to start things off, lung cancer is very common. It is the second most common cancer in the US, excluding skin cancer. It is also the most fatal. So this graph shows the American Cancer Society estimates for the number of new cancer cases in the United States. And this graph estimates new cancer cases in 2020 for the 4 most common cancers. And as you can see, it is estimated that 228,820 people were diagnosed with lung cancer in 2020 in the US alone. So to put this number in perspective, it is estimated that about 6% of people will develop lung cancer during their lifetime in the United States. That means about 1 in every 15 men and 1 in every 17 women will be diagnosed with lung cancer. Moreover, not only is lung cancer very common, but it is also very fatal. Lung cancer is the leading cause of cancer-related death in the US and the world. In 2020, it is estimated that lung cancer claimed the lives of 135,720 people. And this graph shows the American lung cancer estimates for the number of cancer-related deaths in the United States. So as you can see, lung cancer is far more fatal than breast, prostate, or colon cancer, causing more deaths than all 3 of those combined. And every year, there are about 50,000 more new cases of breast cancer, but lung cancer still causes over 90,000 more deaths. And in women alone, every year, lung cancer causes more deaths than breast cancer, ovarian cancer, and uterine cancer combined. If we look at lung cancer incidence and mortality by sex and race, you can see that among males, lung cancer incidence is highest in Black males, and at an incident rate of about 71.7 per 100,000 people. And among females, lung cancer incidence is highest in white females at an incident rate of about 44.7. So mortality also mirrors incident rates. So Black males have the highest mortality rate among males, while white females have the highest mortality rate among females. And so from this question, the question that arises is, why is lung cancer mortality so high? Well, lung cancer mortality is so high because patients are typically diagnosed at a later stage. So this graph, looking at the proportion of patients with lung cancer by stage, it shows that stage is a way for doctors to classify a cancerous tumor based on tumor size. So, and it's also determined by whether the cancer has spread to your lymph nodes and if the cancer has spread to other locations in your body. So currently, most lung cancers are diagnosed at a distant stage when the cancer has spread beyond the site in which it was originally found. And so this graph is based off of data from 2008 to 2017, published by the National Cancer Institute. And you can see about 21% of patients are diagnosed at a localized stage, while about 51% of lung cancers are diagnosed at a distant stage, when the cancer has already spread to other locations in the body. So why is this important? Well, it's important because the stage at which the lung cancer is diagnosed correlates directly with survival. And we'll see that in the next slide. One way doctors track survival of patients is by looking at 5-year survival. And as you can see here, the 5-year survival for lung cancer at early stages is high, but the 5-year survival significantly drops as disease progresses. And so this graph is another way to understand the relationship between the stage at diagnosis and 5-year survival. The 5-year survival for patients with localized lung cancer is 57.7%, but only 21.5% of lung cancers are even diagnosed at that stage. In comparison, nearly half of lung cancers are diagnosed at the distant stage. And this is why early detection of lung cancer is so important. If we can detect lung cancer at an early stage, then treatment options are better and prognosis is therefore better. So with lung cancer being such a morbid disease, some of you might be wondering why the majority of lung cancers are diagnosed at a later stage. Well, the majority of patients who are diagnosed with late stage lung cancer is because they don't start feeling any of the symptoms of lung cancer until the cancer has already grown and spread. So the most common symptoms of lung cancer are chronic cough, coughing up blood, chest pain, and shortness of breath. And additional symptoms may include things like hoarseness, loss of appetite, fatigue, and persistent lower respiratory infections. So when people become symptomatic, the cancer has already grown and spread to a point where it is more difficult to treat and prognosis is poor. And if the diagnosis of cancer has to wait until the patient has symptoms, it is difficult to catch the lung cancer early. So then the question that we ask is, how do we catch lung cancer early if patients are asymptomatic? And one of the best ways that we can do this is through lung cancer screening. Lung cancer screening is done using something called low-dose computed tomography scan. And a lot of you have probably already heard this. It's also called low-dose CT scan. And if you are eligible for lung cancer screening, then it is recommended that you get an annual lung cancer screening. So in the coming slides, we will discuss what lung cancer screening is, who should get screened, and how to get screened. An important distinction that we want to make is that lung cancer screening is done using low-dose CT scan and not chest X-ray. So we'll get into why low-dose CT scan, why we use that in a few slides, but the primary takeaway here is that low-dose CT scan provides more detailed pictures than chest X-ray and are better at finding small abnormal areas in the lung. So the picture on the left is a picture of a chest X-ray, and the yellow arrows that you can see on the slide point to the abnormal area in the lungs. But as you can see, it is a little bit unclear. On the other hand, the image on the right is a picture of a low-dose CT scan of the chest. And the red arrows point to the abnormal area in the lungs. And as you can see, this image is more detailed than the chest X-ray, and this enables us to see the abnormal area in the lung with greater detail. And the question that researchers wanted to answer is, how effective is low-dose CT scan at detecting lung cancers at an early stage? An important lung cancer screening trial called the National Lung Screening Trial, or NLST, tried to answer this very question. The NLST was a large national study with over 50,000 patients. And the goal of this study was to determine the effectiveness of using low-dose CT scan to detect lung cancer in patients who were considered high risk for lung cancer. And so the study included two main groups, one group of patients who received annual low-dose CT scans, and a group of patients who received the annual chest X-ray. And so by comparing the stages at which cancers were caught between these two groups, the study was able to determine if low-dose CT scan was better at catching more lung cancers at an early stage. And as you can see, of everyone diagnosed with lung cancer, the low-dose CT scan caught the most lung cancers at an early stage, while X-ray diagnosed more patients at stage 4, which is a later stage. So this has important implications for survival. Because the low-dose CT scan caught more lung cancers at an early stage, these cancers were more likely to be treatable and the prognosis was much better. And this translates to about a 20% reduction in mortality for those who underwent lung cancer screening at low-dose CT compared to an X-ray. A concern with CT screening tests is accuracy, though. Essentially, how good is low-dose CT scan at catching lung cancer? For every 100 individuals undergoing CT lung screening, 75 will be negative. And of those 75 that are negative, 97.7 to 100% truly do not have lung cancer. So this means that the test is very good at identifying people who do not have lung cancer. That is, if you have lung cancer, the test will most likely come back positive and the test will not miss your cancer. So if we move our attention to the 25 individuals that are positive, 23 turn out to be negative for cancer, primarily with follow-up imaging alone. So this means that even if your test result is a false positive, it's really easy to rule out cancer using further non-invasive imaging. And the 2 individuals that have positive test results and truly do have lung cancer are more likely to be diagnosed at an early stage than if they were not to undergo lung cancer screening. This means that their treatment options and prognosis are much better. So the results of the NLST were published in 2011, so about 10 years ago. And several studies have been published since then, further confirming the life-saving benefits of lung cancer screening in high-risk populations. And one of the most important is the Nelson trial, which we'll look at in the next slide. So in February of 2020, the results of the Nelson trial were published. And like the NLST, the Nelson trial had 2 groups. However, the difference is that the Nelson had a group that received low-dose CT scan and a group that received no screening of any kind. And a total of 13,195 men and 2,594 women between the ages of 50 and 74 were randomly assigned to undergo CT screening at T0, which is baseline, year 1, year 3, and year 5.5, or they had no screening. And so these results confirmed the life-saving benefits of lung cancer screening using low-dose CT. So in the screening group, 58.6% of lung cancers were diagnosed at stage 1. However, in the non-screening group, 13.5% of lung cancers were diagnosed at stage 1. So a much lower percentage of individuals. And early detection, as we've seen, translates into reduction in mortality. So in the low-dose CT group, there was a 24% reduction in lung cancer mortality in men and a 33% reduction in lung cancer mortality in women when compared to no screening. So the Nelson trial also showed that improvements in low-dose CT technology, we can reduce the number of false positive rates that we get with CT screening. So lung cancer screening significantly reduces lung cancer mortality. The question that arises now is, who should get screened for lung cancer? The United States Preventive Service Task Force, also known as the USPSTF, sets guidelines for who should be screened for lung cancer. Right now, they recommend that people between the ages of 55 and 80 who have a 30-pack year smoking history or greater, and who are current or former smokers who quit within the last 15 years, get low-dose CT scans. So the current screening guidelines, as we saw on the previous slide, require you to have a 30-pack year smoking history. Now, pack year is probably a term that most of you have not heard before, but it is just a way for doctors to track your smoking history over a period of time. And so pack year is defined as smoking a pack of cigarettes per day for a year. So for example, if you were to smoke one pack a day for 30 years, that would equate to a 30-pack year smoking history. Alternatively, if you were to smoke 2 packs a day for 15 years, that would also equate to a 30-pack year smoking history. The important takeaway here is that there are many different ways to reach 30-pack years. And the PAC here is a way to help doctors track your smoking history. However, it is important to note that the USPSTF guidelines are in the process of being updated. In the summer of 2020, the USPSTF released new lung cancer screening draft guidelines. And under the new draft guidelines, the lower age bound is lowered from 55 to 50 years. And the PAC year smoking history is lowered from 30 PAC years to 20 PAC years. And with these new guidelines, there's almost a double increase in the number of individuals who are eligible for lung cancer screening in the US. And notably, the most apparent increases in eligibility occur among women and minority groups. So, however, while these guidelines will include more high-risk individuals, they only include individuals with heavy smoking histories. There are other risk factors for lung cancer that are not accounted for in the current screening guidelines, which is very important to address. And these additional risk factors include exposure to secondhand smoke, exposure to radon, exposure to asbestos, and family history of lung cancer, as well as COPD and previous radiation therapy to the lungs. And it is important that we recognize these additional risk factors. Because while lung cancer has a strong association with smoking, there are still a large number of people in the US who have never smoked, but that still get lung cancer. And never smokers are defined as individuals who have smoked less than 100 cigarettes in their lifetime. And because lung cancer has such a strong association with smoking, people are often surprised to learn that lung cancer in never smokers accounts for about 10 to 20% of lung cancer diagnoses and is the 7th leading cause of cancer-related death in the US. So more never smokers die from lung cancer each year than people die from ovarian cancer. And this graph shows the proportion of lung cancer cases that occur in people who have smoked in their life and those who have never smoked. And it is also further broken down by whether they are current, former, or never smokers. And you can see that 80 to 90% of lung cancers occur in people who have smoked during their lifetime, but about 10 to 20% occur in never smokers. And interestingly, women are more likely to be never smokers when diagnosed with lung cancer. And in fact, in the US, 60 to 70% of never smokers diagnosed with lung cancer are women. So right now, lung cancer screening is not recommended for individuals who have never smoked. However, understanding lung cancer in never smokers is a current focus of research. So with the development of new screening technologies and risk models, there may be a way to identify high-risk never smokers who should also be screened for lung cancer. So in summary, lung cancer is the leading cause of cancer-related death in the US. And it is so deadly because most lung cancers are diagnosed at a late stage, when the cancer is already spread to other locations in the body. And importantly, early detection through lung cancer screening by the use of low-dose CT can reduce lung cancer mortality by up to 33%. However, currently, only 5.7% of high-risk individuals are getting screened for lung cancer. And to put this number into perspective and to show you how low that really is, we compare the lung cancer screening rate to the screening rates for breast, cervical, and colon cancer. And all 4 of these cancers have screening tests that are recommended by the USPSTF. And right now, only 5.7% of high-risk individuals are getting screened for lung cancer. So this rate is extremely low in comparison to the screening rates, as you can see for breast, cervical, and colon cancer. And the American Lung Association estimates that if we were to screen every high-risk individual recommended by the USPSTF in the US, we could save 48,000 lives. However, we are only screening 5.7% of high-risk individuals, which means that a lot of lives that could be saved are not being saved. So why is that? Well, the lung cancer screening rate is low for a number of reasons, including limited awareness and concerns about access to screening. Additionally, the cost of screening, the safety of screening, and some other factors that are related to these. So in the next few slides, we'll discuss each of these topics. The important takeaway, though, is that lung cancer screening can help you reduce your risk of dying from lung cancer. The first potential concern that we'll address is the cost of lung cancer screening. The average low-dose CT scans cost anywhere between $300 to $400, but most insurance companies, including Medicare and Medicaid, will cover the cost for eligible patients. However, there are a few exceptions. So one, Medicare will only cover lung cancer screening until the age of 77. And not all Medicaid plans cover lung cancer screening. And three, patients will still pay the usual fees for provider appointments before or after the scan. And like I mentioned before, unfortunately, not all state Medicaid plans cover lung cancer screening. And here's a map that was updated in July that shows which state Medicaid plans do and do not cover lung cancer screening. The blue states have state Medicaid plans that cover lung cancer screening, and the purple states do not. And the pink states are ones that we don't have information available for. So the first step in getting a patient screened for lung cancer is simply having them talk to their primary care provider. And there are certain questions that a primary care provider has to ask and topics that need to be discussed. And one of these is the patient's pack your smoking history, which we saw how to calculate in the earlier slides. And to find accredited lung cancer screening centers, patients can go to the American College of Radiology website. And they can simply type in the state or city that they live in to see where accredited lung cancer screening facilities are located near them. And the American College of Radiology website is listed on the bottom left-hand side of the screen. And this is a map of accredited lung cancer screening facilities in Reno. And as you can see, each red pin represents an accredited screening center. As far as how the experience of getting a low-dose CT scan goes, it will require you to lay on your back for about 5 minutes. And you will be doing something very similar to what the patient is doing in the photo. And one thing to note is that this process will not hurt at all. And this is because with low-dose CT scans, you do not need to use contrast. And this means that there will not be any needles or injections involved. And low-dose CT scan is non-invasive, fast, and completely pain-free. Additionally, the amount of radiation you receive is very low. During a low-dose CT scan, you will be exposed to radiation, but as I mentioned in the previous slide, this amount is very small. And a way that doctors measure the amount of radiation a patient may receive is through a unit called the millisievert. And this is just a way to measure radiation and compare the levels of radiation received during different activities and over time. So for low-dose CT scan, you will be exposed to 1.5 to 2 millisieverts of radiation. And this is a lot lower than a full chest CT scan, which requires a radiation dose of 8 millisieverts. And to put that in perspective, you are exposed to 3.11 millisieverts of radiation a year just from breathing, cosmic radiation, eating, and radiation from the earth. So as you can see, a low-dose CT scan exposes you to less radiation than you are exposed to from just existing on Earth, which means that the level of radiation you receive from an annual lung cancer screening test is very small. That being said, this is always something that patients can discuss with their primary care provider. So once a patient has talked with their primary care doctor, and the PCP referred the patient to a screening center and they received a low-dose CT scan, what's next? Well, the doctor will receive the results of the patient's screening test and will follow up with the patient to go over the results. As far as results go, there are 3 most likely outcomes. The first outcome is the scans are normal. And if this is the case, then the patient should look to get repeat scans in a year. If the scans are abnormal, but probably benign, then the patient should talk to their doctor about the next steps. And these next steps may include more scans, tests, or biopsies. And if the scans are abnormal or suspicious, then the patient will likely have to undergo additional testing, such as a biopsy. So lung cancer screening saves lives. But a question you may be wondering is, can individuals still get screened for lung cancer during the COVID-19 pandemic? And if is it safe to do so? During the pandemic, the number of lung cancer screenings has decreased significantly. However, lung cancer won't stop because of the pandemic. So if a patient is at high risk for developing lung cancer, it is important that they still get their annual lung cancer screening test. And right now, most hospitals have operating lung cancer screening programs, and patients can wear a mask during the entire screening process. So as long as patients follow the necessary precautions, like wearing a mask, lung cancer screening during the pandemic is safe. And the pandemic should not deter patients from getting screened for lung cancer. Additionally, while lung cancer has the potential to save many lives, it is important to address smoking cessation in the context of lung cancer screening. Lung cancer screening is not a substitute for smoking cessation. Likewise, smoking cessation is not a substitute for lung cancer screening. Smoking cessation is one of the best ways to prevent lung cancer, and lung cancer screening is one of the best ways to detect lung cancer. So using both is going to be the best way to fight the disease. And for every year after an individual quits smoking, their risk for lung cancer is reduced by 8 to 17%, depending on the type of lung cancer that they have. And another reason that smoking cessation is important is because it is required by Medicare and Medicaid services for lung cancer screening programs. However, we do understand that smoking cessation can be difficult, and there are a lot of resources for people trying to quit smoking. And some great programs in our local area are the renowned Health and Wellness Quit Smoking Program and the Nevada Cancer Coalition's Quit Smoking Program. So as this presentation comes to a conclusion, we want to end on what we, the American Lung Cancer Screening Initiative, are doing to begin the widespread awareness, education, and advocacy efforts that are necessary to increase lung cancer screening rate. Lung cancer is the deadliest cancer in the world, and with lung cancer screening, we can save so many lives. And right now, currently, very few high-risk individuals are being screened. And so some of the steps that ALCSI is taking is that we are working to address all aspects of this issue. We wrote and advocated for House and Senate resolutions expressing support for Lung Cancer Awareness Month and early detection through lung cancer screening. And last December, our Senate resolution was passed by unanimous consent. Additionally, we are working to teach communities across the country about lung cancer and lung cancer screening. Lung cancer is, like I've mentioned several times, the deadliest cancer in the world. But by working together, we can overcome it and save millions of lives. And it starts simply by raising awareness and initiating lung cancer screening programs in our own communities. And we believe that by educating communities, especially students, about lung cancer and lung cancer screening, we can help lower the number of deaths associated with the disease. Students are greatly impact and influence the healthcare of their parents, and we hope that by educating students about important measures that can be taken, we will not only be able to help the students, but also their family members. So we are so grateful to Ren and Mega for helping us set up this webinar, and thank you all so much for your time. We hope that you were able to leave this presentation with a better understanding of lung cancer and lung cancer screening process. And as we all know, lung cancer is a big problem. It is very common and it is very fatal. That being said, there are tools that we can use and actions that we can take to help reduce lung cancer mortality. And one of the best ones, and the topic of this presentation, is lung cancer screening. The American Lung Cancer Screening Initiative is always looking for ways to raise awareness for lung cancer and lung cancer screening. So if you have any questions, please feel free to ask them in the following Q&A session. And additionally, if you're interested in helping raise awareness for lung cancer in your community, we would love to work together. And you can send us an email or ask us during the following Q&A. So that's it for the presentation, and I'll now open it up for questions and answers. And I have both Alex Potter, who is an undergraduate student at UC Berkeley, who is a program director of ALCSI, as I mentioned earlier, and Dr. Jeffrey Yang, who can also answer your questions.
Are there screening opportunities in other countries as well, or is it just America that focuses on lung cancer screening?
Yeah, that's a great question. Thank you for asking. Alex, do you want to maybe take this one?
Sure. So that's an excellent question. And there are, not in all countries, in a lot of developing countries. So we've given presentations in India on the importance of lung cancer screening, but right now they don't have lung cancer screening programs in India. The United States is one of the only countries that has lung cancer screening. They have it in Canada, and then it's starting in Europe. But right now in the US is really where we have lung cancer screening programs. Please feel free to jump in if you have any questions, but I was curious, how many of you all have heard of lung cancer screening before this presentation? You can turn off your mic too if you want to talk, but it looks like people are shaking their heads. Okay, I'll take that as a collective, not a lot of people, which is totally normal because not a lot of people know about lung cancer screening, and it's really why it's so important that we educate about it and teach each other about it, so that we can learn about it right now when we're young, and first of all, smoking at our age we shouldn't be doing, but we can also use this information to help our family members, as Priyanka mentioned. And if you have parents or grandparents that might fall into those guidelines, which are if they're between the age of 55 and 80, and they have a 30-pack-year smoking history, and they either currently smoke or they've quit within the last 15 years, it's recommended that they get screened for lung cancer right now. And so if you have parents or grandparents that fall into that category, I would really encourage you to reach out to them and talk to them about, talking to their primary care doctor about getting screened for lung cancer, because it's so important. As Priyanka, explained, that lung cancer is the leading cause of cancer-related death. But if we can screen people and we can detect it early, we can save so many lives. And that's really why Priyanka gave this presentation, and it's really why ALCSI, what we do the work that we do. So I think one of the main takeaways, if you guys can take away anything from this presentation, is that please, talk to your parents, your grandparents, talk to aunts and uncles, people and just start raising awareness and making sure that people know that there's this service out here to help them if they qualify. Yeah, go ahead. Yeah.
Yeah, Mega. Hi. Do you guys have any, or are you like planning, do you have like specific initiatives for educating low-income communities, or do you have any like, yeah, like just initiatives that advocate for low-income communities? Because that's like really cool, and I think obviously from your presentation, lung cancer is very important to be educated on. So
Yeah,
yeah.
that's an excellent question, and something we would absolutely love to be doing. Right now we're really just focusing on reaching out, sending a bunch of emails to whoever we can get to partner with. And so we have worked with like the American Indian Cancer Foundation to give a presentation about lung cancer to them. But we don't have a specific initiative right now that's currently focused directly on that. But I think that's an excellent recommendation and something that we would love to definitely do in the coming months and year.
Yeah, we've given presentations at homeless shelters before, and folks who need a place to stay. For example, Morville House in Boston, as well as some other places, but we don't have a organized initiative yet. So, but that's definitely something where if anybody here is interested in helping us with, we'd love to have you, because during the time of the pandemic, a lot of these messages. So when we talked, for example, to that homeless shelter, it was in person, but in the time of the pandemic, everything is by Zoom, and which means that you can give a presentation in Nevada, or you could be in Nevada but give a presentation in Alaska or Florida or Boston, as long as you have as long as somebody has a computer or even a phone. Like that homeless shelter presentation, some of us just zoomed in because not everybody had a computer, so it's just their own phone. that they use to log in. So.
Yeah, that's like amazing. I definitely think it's like a prominent issue. Like I think smoking is definitely higher in low income communities. It's like a coping method and it's very it's really, really sad what people have to go through. So yeah, I'm glad that education is happening. I would love to like work on like local or like the Reno local environment with you guys if you'd be interested. Uh, because yeah, that is really important. Cancer awareness, just so everybody is fully educated.
Yeah, that would be fantastic. So definitely send us, any one of us. You probably have Priyanka's email, right? So yeah, definitely send her an email, and we'll put our emails in the chat here too. So
With my speaker, can you guys hear me okay? Okay, awesome. So sorry about that. I got a question in the chat asking about what other additional resources that we have that we can share with you guys. And so I would like to just go back to the previous slide that I had up here. And the ALCSI, we'd like to invite you guys to visit our website at www.alci.org. And the ALCSI organizes several webinars and information sessions about lung cancer and lung cancer screening. We have talks from doctors and who are working in this field. And so we would love to have, everyone is welcome to attend, and we would love if you guys could share these links for those who are interested in joining.
just out of curiosity for our learning, does anybody currently know anybody who would fit the criteria for lung cancer screening? Okay, so Lily and anybody else? Okay. Is it two people? Lily and Julia. Is that right? Or who? Jay Burnett, whoever Jay Burnett. Um, yeah, so two folks. Yeah, so so definitely if you know folks who, sorry, Jessica, if you know anybody, feel free to send them some materials. What we have found is that so we've given presentations all across the US now. And sometimes you'll go to an audience and everybody seems to be healthy. And, but you'll find folks who will tell you that, they quit 10 years ago, for example, and, or somebody will know somebody who has lung cancer. So, if you do know and you send them this information, it's going to be so powerful and really helpful to save their life. So I yesterday operated on a patient who is going to go home tomorrow, but his lung cancer was just discovered incidentally. So when we say something is discovered incidentally, we mean that it wasn't it was picked up not because they were looking for lung cancer, it was because they were looking for something else. And I can't tell you how many times we have seen that. For example, somebody comes in and they have a tough cold, and they cough a lot, and then the doctor decides to order a CT scan, and it was only through that cold that the lung cancer was picked up on. So, later, yeah. But a lot of folks who qualify for lung cancer, they don't get that opportunity to, for example, have that nodule discovered incidentally. And so I've also seen the other way around where it was just somebody who it probably should have been discovered 3 or 4 years ago, but it was too late. And then they had stage 4 lung cancer. So yes. Yeah, go ahead, Mega.
Great. If someone has asthma, does that increase your chance for lung or like increase like progress the development of lung cancer or increase your chance for it?
Yeah, Priyanka, do you want to take that one or?
I'll hand this over to Alex since I think she'll be able to.
Okay.
Um, so if you have lung diseases, that is an additional risk factor for lung cancer. So asthma, COPD, a couple of those you saw on the additional risk factors slide, can increase your risk for lung cancer. But right now, not to the same extent that smoking does, which is why we don't include it in the guidelines. But it can.
Makes sense. Thank you.
Yeah, and that's something where people, we need more research in. And so, you know, if there are any folks in the audience who want to tackle a really big problem, it would be lung cancer, and being able to figure out how to screen folks who might be at risk for lung cancer but have never smoked. That's something that will probably that's a problem that a lot of folks are going to try to solve over the next couple decades. So, but that's an important question, and it's an important problem. So.
I think the last question that I got in the chat was a person who was asking what Dr. Yang specializes in. So Dr. Yang is actually a thoracic surgeon at Massachusetts General Hospital and an assistant professor of surgery at Harvard Medical School. And so Dr. Yang, if you want to add anything to that.
Sure, thanks. So yeah, so I'm a surgeon, so I operate on any type of cancer in the chest. And right now, my main focus is on lung cancer in terms of research. But clinically, I take care of lung cancer patients, folks who have esophageal cancer or thymic malignancies, mediastinal masses, sarcomas. So, and basically any problem. And also if they don't have cancer, but they have a problem in the chest, like a hiatal hernia, which is when sometimes people's colons or their guts are going to be in their chest. You know, your intestines are supposed to stay in your belly, but sometimes they will migrate to your chest. And so those kind of problems I also take care of. So.
Okay, are there any other questions that we didn't answer? Thank you guys for asking all these great questions.
I just have one if there's any extra time.
Yeah,
What
definitely.
what is the main factor that's going to end up influencing a cancer's survivability rate? Because I see like it's really disparate between cancers. So what is responsible for that?
See, Alex or Priyanka, do you guys want to take that one?
Priyanka, do you want to go, or I can take it if you don't?
Yeah, sure. So I'm probably not as experienced as Alex or Dr. Yang are, so they might want to add a little bit to my answer. But there's going to be several different. Every patient is going to be different, and there's going to be several factors that can affect their survivability rate and their prognosis. And so some of the things might just be their underlying condition, how late, like we talked about in the presentation, how early the lung cancer or cancer in general was diagnosed, and based on other factors, so maybe family history and underlying condition that they might have can affect what types of treatments we're able to give them. And so all these together will kind of affect how we're able to treat them and in the end affect their survivability. And Alex and Dr. Yang, if you want to add anything to that.
Yeah, I think that's a great answer. I think to just summarize, for lung cancer, if we can detect it early, that's probably the biggest factor that will affect how well the prognosis. Because if we can detect it early, then we can remove it surgically, and that it really gives most patients the best chance at surviving long. Yeah.
Yeah, basically, even in 2021, the best cure for cancer is to remove it from the body. So I remember when I was in college, now 20 years ago, that there's all this talk about, you know, genomic therapy and stem cells and, you know, targeted therapy, immunotherapy, and there's been some development for that where it's been more helpful for certain types of cancer, but it's still overwhelmingly not very effective. The cancer almost always comes back. So the best way to get rid of it and for have long-term survival is to simply remove it completely. And then the best way to do that is if you discover it early. So obviously when it has spread, it's impossible. For example, if it's spread to the brain and to the liver, it's impossible to then surgically remove it. And then that's when you would do the chemotherapy, radiation, immunotherapy, targeted therapies, and the things that you might have heard about. So, but yeah, those factors are important. So let's see, there's another question that just came up from Jessica. Are the people who discover they have stage 4 cancer more likely to be in a lower income family? Or rather, is there any connection between income and survivability rate? That is a great question, Jessica. We can work on that and then let you know in a few months. So that is, yeah. And, you know, feel free to keep in touch with us to see what we find. And if you're interested in trying to tackle that question with us. So we have Priyanka and Alex are doing research with the National Cancer Database and looking at different factors. Not this particular question though. So we can definitely take a look at that. So. Great. And then I guess, you know, just one last closing comment is our website actually has both English and Spanish and Chinese materials for folks. So, you know, a question that just had come up was whether or not, like how do you get in touch with folks who are, for example, in China and things like that. So we have different language brochures as well. So.
Awesome. So I think if anyone has any questions, please ask them right now if you have them, or send us an email. We're always open, and we really encourage you guys to continue to explore this. And then for anybody who you know that falls under these guidelines, please, you know, talk to them and teach them yourselves about the importance of screening. And then if there aren't any questions right now, I'll hand it over to Priyanka to conclude the presentation.
Yeah, thank you, Alex. Thank you guys all for coming and for participating. I hope that this presentation taught you a little bit about lung cancer and lung cancer screening. And if you, like Alex said, if you're interested in learning more or are figuring out a way that you can make an impact on your local community, please feel free to contact us and we can provide you with any materials or information that you can use. And I once again want to thank Mega and Ren for making this possible, because this was a great opportunity. We've been wanting to educate students and give presentations to high school, so this is a great way for us to do that. So thank you guys so much.
Yeah, thank you everyone for coming. Really appreciate it.
Thank you.
Hi.
Okay, there's a chance.
Oh, you're muted.
Can everyone hear me? Everyone see me?
Yep.
Okay, cool. I just wanted to say, I think the other people hopped out, but Priyanka, you did a really fantastic job with this. You were very thorough, very informative, very educational. And you know, here at MedLife, we're all about the education. We believe in the power of education. And you like you said, the information that you presented here today has the potential to save lives. So thank you for being thorough and thank you for being informative. That was really incredible. And again, like I think they hopped out, but I wanted to say thank you to Alex and Dr. Yang as well for joining us today, and you're welcome back anytime.